Hi there, it's Cindy Heiser here with my 1-year update after rotator cuff surgery. So I went and saw my surgeon last week, and after the visit was released without restriction, which is really awesome. I had been going according to a plan that said, there were a lot of things I could do, a lot of things I could work on, but to not do very much in the way of overhead lifting. And when I'm talking about not very much, I mean not very much. Like I was doing before the visit, I was doing as much as 3 pounds overhead. So that, it's like was because the surgeon was worried about my having setbacks related to pushing in that direction, and now he feels like the repair is completely solid and so I could go forth. He was a little surprised when I reported my activity level, because I told him I'm now swimming a mile a couple times a week. I'm swimming it more slowly and doing it a little bit more like an individual medley than I used to do, but I am swimming a mile. I put some hardscape in my backyard, which meant carrying a few bags of gravel from the back of my car to the place in the backyard where the hardscape was, and I thought, either this will go well or it will go poorly, but it was fine. So I was, maybe a little sore, but I was careful in my lifting and carrying techniques, and the shoulder did fine. So I'm really excited about that. I'm still having some range of motion issues. Again, my shoulder healed as a quote stiff shoulder, meaning that there's a lot of scar tissue. The repair is super solid, but it's still a little bit difficult for me to move my arm as freely as I did before the surgery. So I'm at least now able to reach behind my back, get up to about mid-back. I'm still, working on that, but it's exciting because I can almost wash my whole back now with, both hands and not even having to use a back brush. I can reach up overhead. It's still, you can see there's a difference. It's still a little impinged, and that's without stretching this morning. But on the other hand, I am gaining strength. I keep working with myself, making some different exercises up. So my biggest problem has been external rotation related exercise. And so that includes things like reaching behind the back. It includes things like putting the hands behind the head. Now you'll notice I can do the hands behind the head, but my right arm's not quite as far back, and there's still kind of a bulky stickiness, like the shoulder kind of wants to move as a mass sometimes, rather than having that nice little hinge that happens with an unsurgical shoulder. So still working on that with exercise and with stretching. So I stretch every day. I'm down to doing strengthening every other day, but the strengthening routine is pretty robust, and it takes me about an hour. It's a combination of free weight, body weight, and bands. And I'm up to doing, a couple sets of 10 girly push-ups on my knees. So that's on the floor rather than using a platform, which is different. I was doing kind of like the full-on plank, but on a 20-inch platform before I transitioned to doing that on the floor. So it's just kind of baby steps. One of the things that the PT person had advised me was, as I'm gaining strength, just take my time incrementing the strength. So for instance, I recently, like this week, went up to doing 5 pounds overhead in each hand, and I'm like, woohoo, I'm really big and strong, but it's, I have a lot of stability, and the thing is the strength in the pushing direction. I'm okay if I have to let things down, and honestly, I've got really pretty good function. I did go on a plane trip about a month ago and was able to, I had a bag that probably weighed, I don't know, 10 or 12 pounds. Not difficult for me to put the bag in the overhead bin. I actually took the risk of getting a kitty litter box out of an upper shelf at the grocery store a couple weeks ago. That thing weighed probably 17 pounds. So, I'm doing it with both hands, but it's up here to start with, and my shoulder sounded like a popcorn factory, but nothing worse happens. So anyway, all this to say that I have very good function now. I'm still working on my range of motion. The doctor seems to think it'll be, 4 to 6 months. And typically for this surgery, it can be 1 year to 2 years. So I'm past the year mark. But given the level of my overall function, I really can't complain. So anyway, thank you so much for checking in here. I'm really delighted to report this progress, and you guys take care. If you're having the surgery, from my perspective, it's really been worth it. Like, I've had to go through a lot, but I'm riding my bike 10 miles now, swimming a mile, really doing, my life mostly the way that I was doing it before the surgery. So that's pretty awesome. So anyway, okay, you guys take care. Thanks again. Bye-bye.